Let's discuss the extra point, Shixuan 10 diffusion EX upper extremity 11 and Shiqizhui below the 7th vertebra EX-B-8. Location on the tip of the 10 fingers. How to find? These 10 points are located on the tips of the 10 fingers, approximately 0.1 tune from the free margin of the fingernails. Located in a comparable position on the foot are the points of EX lower extremity 12 on the tips of the 10 toes. Needling, prick to bleed. Actions indications, expels pathogenic factors. Needling, prick to bleed. This may be followed by moxibustion. Actions, open the portals and revives consciousness, drains heat, and pacifies wind. Indications, loss of consciousness, wind stroke, summer heat stroke, febrile disease, swelling, and pain of the throat, acute childhood fright, wind, clonic spasm, epilepsy, mania, vomiting, diarrhea, numbness, or pain of the fingers. The points were first discussed in the 1,000 Ducat formulas by the great 7th century physician Sun Si Miao. They are almost exclusively used for acute conditions such as loss of consciousness, including the acute phase of wind stroke, epilepsy, heat stroke, sunstroke, etc. They are usually pricked to bleed, a procedure which may occasionally be followed by moxibustion. EX-B-8 below the 7th vertebra, location on the midline below the spinous process of the 5th lumbar vertebra L5. How to find, locate the tough ears line L4, next palpate in an inferior direction to the next vertebra L5 and locate EX-B-8 below the border of its spinous process at the lumbosacral joint. Located on the same level are a point of EX-B2, bladder 26.5, 1.5 tune lateral to the midline. Needling 0.5 to 1 tune vertically to the skin or obliquely in an inferior direction. The patient's back should be straight or slightly flexed to avoid the spinal puncture. Oblique insertions in a superior direction should only be carried out by experienced practitioners, as in small persons, regardless of their weight, the spinal canal can be reached after only 1.25 tune. Caution, in pregnant women about to go into labor, this point have a labor-promoting effect. Actions indications, tonifies the kidneys, opens the channel locally. Location notes, slide a finger upward along the midline of this sacrum until it meets the significant depression inferior to the lumbar spine. Needling, perpendicular insertion 0.5 to 1 tune. Caution, the spinal canal lies between 1.25 and 1.75 tune deep to the skin surface, varying according to body build. Actions, tonifies the kidneys and promotes urination, activates the channel and alleviates pain. Indications, pain of the lumbar region and legs, difficult urination, fetus pressing on the bladder. MBW25 was first mentioned in the supplement to the 1,000 Ducat formulas. It is among the most commonly used points for chronic back pain and is very often found to be the focus of tenderness. It may be used in both deficiency and excess patterns and in the frequently encountered clinical situation where the two are found in combination. Combinations, chronic lumbar pain, MBW25, bladder 26, bladder 53, bladder 40.